Hello dear students, today we will talk about diuretics. Diuretics are drugs that induce a state of increased urine flow. The kidney regulates the ionic composition and volume of urine by the active reabsorption and or secretion of ions and or the passive reabsorption of water at 5 functional zones along the nephron, which are the proximal convoluted tubule, the descending loop of the Henle, the ascending loop of Henle, the distal convoluted tubule, and the collecting duct. The proximal convoluted tubule is located in the cortex of the kidney, and almost all the glucose, bicarbonate, amino acid, and other metabolites, as well as 2/3 of the sodium, is reabsorbed here. And also it is the site of the organic acid and base secretory system, which is the system that delivers post-diuretic drugs to the tubular fluid. So the remaining filtrate, which is isotonic, enters the descending limb of the loop of Henle and passes into the medulla of the kidney. Here, the osmolarity increases along the descending portion of the loop of Henle because of the counter-current mechanism that is responsible for water reabsorption. And osmotic diuretics act in this part of the nephron. The cells of the ascending tubular epithelium are unique in being impermeable to water. And the active reabsorption of sodium, potassium, and chloride is mediated by the sodium-potassium 2 chloride co-transporter. This ascending loop is a dilated region of the nephron, and loop diuretics act in this site, and they have high efficacy because this site is the major site for salt reabsorption. The cells of distal convoluted tubule are also impermeable to water, and almost 10% of the filtered sodium chloride is reabsorbed via the sodium chloride transporter that is sensitive to thiazide diuretics. The principal cells of the collecting tubule are responsible for the sodium, potassium, and water transport, and the sodium enters these principal cells through channels which are the epithelial sodium channels, and these channels are inhibited by amyloid and trientine. Once inside the cell, sodium reabsorption relies on sodium-potassium ATPase to be transported to the blood, and aldosterone receptors in the principal cells influence this sodium reabsorption and potassium excretion. Diuretics are commonly used in hypertension, especially thiazide are the most commonly used because of their ability to not only reduce blood volume but also to dilate arterioles. And they are also used in hypercalcemia. The most common used diuretic are the loop diuretics because they promote calcium excretion. Another indication for diuretics is the diabetes insipidus. When patients suffer from polyuria, polydipsia, and associated with with diabetes insipidus, they usually respond to thiazide diuretics. The drugs in the thiazide group are chlorothiazide and hydrochlorothiazide, while we also have the thiazide-like diuretics which resemble the thiazide structurally, and also they have the same mechanism of action like thiazide, which are the chlorothalidone, indapamide, and metalazone. And the mechanism of action of thiazide are like they act on the cortical region of the ascending loop of Henle and also the distal convoluted tubule to decrease the reabsorption of sodium by inhibition of the sodium chloride transporter on the luminal membrane. Some adverse effects of thiazide diuretics include hypokalemia, and this hypokalemia can be fixed with diet potassium supplementation, like taking citrus fruit, bananas, and prunes. Hyponatremia is another side effect of thiazide diuretics, and limiting water intake and lowering the dose of diuretic can prevent this condition. Hyperuricemia can be caused by thiazide, and also it is important to perform periodic blood tests for the uric acid. Volume depletion, hypercalcemia, and hyperglycemia are also side effects of thiazide diuretics. While the loop diuretics are the bumetanide, furosemide, torsemide, and itacrenic acid, and their major site of action is the ascending loop of Henle. And because with all the diuretics, they have the highest efficacy. And furosemide is the most commonly used loop diuretic. Because of the rapid onset of action of loop diuretics, especially when they are given intravenously, they are useful in emergency situations such as acute pulmonary edema, and they are the drug of choice for using the acute pulmonary edema of the heart failure. And they are also useful in treating hypercalcemia because they stimulate tubular calcium excretion, and they are useful to treat hyperkalemia. Some of the side effects of loop diuretic include ototoxicity, especially when they are used in combination with aminoglycoside antibiotic. And ethylene acid is most likely to cause deafness. Also, another side effect is hyperuricemia, acute hypovolemia, potassium depletion, and hypomagnesemia. And they can be corrected with supplementation, either supplementation or oral supplementation. Potassium-sparing diuretics, which are the amiloride and triamcinolone, and they act in the collecting tubule to inhibit sodium absorption and potassium excretion. And the major use is to treat hypertension, most commonly in combination with thiazide. And these drugs, they should be avoided in patients with renal dysfunction because of the increased risk of hyperkalemia. The aldosterone receptor antagonists, which are the spironolactone and eplerenone, and their mechanism of action are that they antagonize aldosterone at intercellular cytoplasmic receptor sites. And they are obviously used as a diuretic, especially in combination with a thiazide diuretic or loop diuretic, to prevent the potassium excretion of those thiazide and loop diuretics. Also, spironolactone can be used for secondary hyperaldosteronism and heart failure because spironolactone prevents the remodeling that occurs in progressive heart failure patients. Spironolactone, because it chemically resembles some of the sex steroids, it can induce gynecomastia in male patients and menstrual irregularities in female patients. Carbonic anhydrase inhibitors, which is acetazolamide, inhibit the enzyme carbonic anhydrase in the proximal tubular epithelial cells. These drugs are mainly used to treat glaucoma, and because they reduce the elevated intraocular pressure of open-angle glaucoma. And the topical ones, especially the dorzolamide and brinzolamide, they have the advantage of not causing any systemic side effects. Also, these drugs are used for mountain sickness for the prophylaxis of the acute mountain sickness among health patients. And acetazolamide should be avoided in patients with hepatic cirrhosis because it could lead to a decreased excretion of ammonia. Osmotic diuretics like mannitol and urea result in some degree of diuresis because of their ability to carry water with them to the tubular fluid. And this will cause an increase in the urinary output. And these drugs are used to maintain urine flow following acute toxic ingestion of substance capable of producing acute renal failure. And they are the mainstay of treatment for patients with increased intracranial pressure or acute renal failure due to shock, drug toxicity, and trauma. Because maintaining urine flow preserves long-term kidney function and may save the patient from dialysis. Thank you for watching this video. Please don't forget to subscribe to this channel. See you later.